So I'm just going to read what I wrote as I wrote it. So, good evening, everyone, and thank you, Paula and Ellen, for asking me to come along this evening to say something about my personal experience of why this is a critical issue for disabled people. As being diagnosed as having a terminal condition, as I was, makes you a disabled person in law, as it does in life experiences. My name is Kevin. I'm a disabled person. I live independently in the community by way of a 24/7 support package funded by my local authority, the London Borough of Hammersmith and Fulham. I have no religious faith. Religion blighted my early life, and for me, this is not about living for living's sake, but it is the combination of my experience-based concerns that I'm going to highlight altogether that lead me to my opposition. I am using my personal experience to illustrate some of the issues that I feel are being glossed over, and my points are far from just being about me personally. Firstly, I believe we all broadly say we want the same things. I understand a lot of the push from people, including some terminally ill people, want to see much more effective, quick, and tailored support available that is legally enforceable and that we get it when we need it. But that isn't what happens now, as we all know. I was one of those, inverted commas, tragic people that have dominated this public discussion as examples, but the issues must be based on how such a legal change will affect society as a whole, as well as individuals. I am fortunate to be here, as 27 years ago, I was in hospital for nearly 5 months when I was diagnosed with a terminal, inverted commas, rapid onset neurological condition of an AIDS diagnosis with a prognosis of less than 6 months. At a number of points, it was a prognosis of hours. I was issued with a DS 1500 form to access fast track social security benefits, and it was very frightening. I was losing physical and some mental functioning almost on a daily basis, the depths of which were crucifying, both physically and mentally. Beyond isolating when you experience this suddenly, depleted to 4 walls, a hospital bed, machines, and a lot of strangers involved in the most intimate levels of support, providing the most intimate levels of support. At the time, I was desperate beyond words, and I might well have jumped at the opportunity of assisted dying if it was available then, in a fast-moving situation where I had no control and I was on a downward ski slope with no hope. However, treatment worked at the last minute of the last hours, and I'm with you today. I was 34 years old then, and I'm 62 years old now. A few people have said, well, it's all right for you, you survived. And the irony of that is not lost on me. If this bill passes into law, there will be undoubtedly people like me who will die unnecessarily because of the legislation, and you can't bring us back. From my experience, some examples of what I really needed was better trained teams of medical staff and support staff to be able to communicate about what was happening and help in making plans where appropriate. Additional support to spend more time with loved ones, deal better with my affairs, and have very frank, more time-consuming conversations on how to deal with multiple symptoms, pain management, with healthcare professionals that just was not available. My overriding state was one of understandable panic as I was deteriorating so quickly. I wanted more access to mental health support and complementary therapies to help me better get through what was happening. I had no access or the offer of peer support from anyone going through anything similar, and no support from anyone other than professionals and friends and and, 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 family who was struggling. and could not help really because it was not within their experience. Focusing on assisted dying would have given me a possible distraction from all of those important connections at the end of my life, and potentially provided cover to ignore all of the cracks in support provision that were not being addressed. I'm not blaming the amazing team. I'm not blaming the amazing team of healthcare workers that got me through by the skin of my teeth. So much more needs to be done to ramp up support for terminally ill people. Secondly, coercion is not just about family and friends that think they're well intentioned or, in some cases, just wicked people, but there is a societal coercion in every aspect of our lives, ranging from outright hatred, abuse, and discrimination to much more subtle and seeping, heaped up pressures on terminally ill and disabled people. Almost a background mantra whispering that you are better off dead. Coercion is also very difficult to prove on a personal level, and in reality, it's particularly difficult if the victim is dead. As a disabled person, we know that abuse is rife in life. Only yesterday, I think there was a report on economic abuse of women in domestic violence situations, and highlighted that 1 in 7 women have experienced economic abuse by a current or former partner in the past 12 months. And disabled women will be disproportionately reflected in those figures. As a gay man with an AIDS diagnosis during a pandemic, I have throughout my life faced a tsunami of judgment, hatred based just on my health condition and on my sexuality, fueled by the messaging from the government and state during the 80s and 90s, all of which could have pushed me further towards assisted dying, as I was not valued as a human being. Maybe at the time, I would not have been able to articulate those feelings in any assessment for assisted dying. Many of us spent large parts of our lives dragging ourselves out of the cesspit that society allows to proliferate and devalues our lives. I believe this legislation would only further give the state more license to devalue our lives. You are unlikely to really be able to feel the impact and damage of such circumstances unless you are being on the receiving end of it. Threadbare, independent living, social care provision, hospital and community health services in many areas on their knees, including access to quality of life, independent assisted living support. This includes access to hospice support in terms of geography and referral criteria according to different types of terminal illnesses, as well as accessing suitable housing. Many of us experience social and economic inequality that is linked to the unspoken value that is put on our lives and the unequal access we have to social, familial, and state support. The current benefit system adds to making it hardly worth living, with some terminally ill people which reduced to near destitution because of the decimation of what support is available. Demonisation of people in receipt of benefits and the sheer number of barriers for in front of claimants is enough to add to assisted dying tick box. 27 years ago, I could manage the same situation, but now it'd be another tick for me in favour of turning the lights off sooner rather than later. I've been fortunate that I've been able to work. I thought we were all living in the same country, where it's widely acknowledged that every public service is more or less broken. And then I remember only some of us as disabled older people are reliant on statutory essential services. And That's what we need to go on with fixing. You also will not be able to quantify the number of citizens that are lost just from the daily drugs that we experience that leads us down the garden path towards assisted dying. And just lastly, on safeguards, given everything that I've just said, I'm not going to say much about safeguards, only that I think that they are mostly an illusion, because you are in reality unable to regulate against the potential for coercion and abuse. Disabled people will not be safeguarded against a disabled state that may say that it upholds disabled people's rights. After all, we fought and won to get many of those rights into legislation. The reality is that they are often pushed back or relatively meaningless in practice in most of our day-to-day lives. I have to say that I find it is deeply disturbing in the concept of mercy killing, which I have experienced by a doctor authorising the removal of fluids and food without consent, often portrayed by many as an act of mercy. Even with consent, it was the most barbaric, painful, inhumane act that I have ever experienced. I routinely encounter people who are phobic of impairment, illness, and death. Who can reel off a list of realities where they say they would rather be dead than be a wheelchair user or need assistance with personal care. And usually a lot of what is on their list is part of my daily life or my experience. Whilst I can see why people might get to having those reactions, I have no respect for legislators that would be part legalising that viewpoint instead of committing to rebutting it or working towards a legal right for independent living that covers all stages of it. It is the case that a lot of the detail will be probably left to secondary legislation in this process that doesn't return to Parliament and will give an inordinate amount of powers to the Secretary of State, which is deeply disturbing. I do not have a crystal ball to know that in the future the operationalization of this law will become another state-induced public scandal. I met all the criteria proposed with this bill, and my life was going to be limited, ending soonish, and it could have been my choice, inverted commas. But it would have been a very loaded choice for the reasons that I just set out. I would urge you, if you're going to vote yes on Friday, I would urge you, if you're going to vote yes on Friday, to think again and again and again